And then that's the dosage rate. They give that half a cc once a week, or maybe twice a week. So most of the time when they give 3/10 or 4/10, they do it twice a week. But if you give it too often, too fast, you're releasing the toxins too fast, like at the beginning when the clinics were doing the clinical test, and they did not listen, but they've been anxious to have CC every day. And in 2 weeks, the person got into problem with the liver because the liver couldn't handle it. So they backed off and let the liver, recoup and resume the treatment at a much lower dosage rate. It's not recommended to overdo it. The lower rate gives even better result than try to put in too much too fast.
What's the difference between the suppleness of the gentleman that introduced you, which said that the product Chondriana and the other product is not the same as the product that you're producing?
Well, I don't know anything about Chondriana. It's not my product. My product is made from human genetic material. It's called Chondriana. It's under that trade name, and they are little humanoids. They are ancestors made from our defense, made of DNA molecules, or rather our genetic material, and they are 100 micron in size.
Is there anyone here that's representing the Chondriana product, like the gentleman that introduced you, that can tell us the difference?
Well, he was telling at the beginning of this talk that the Chondriana has nothing to do with my Chondriana. At the beginning of the talk, so I think there's not much more to discuss about it. That it's not the same product. So I don't know their product, and the Chondriana cannot be distributed by anyone other than clinics or doctors. That's a product which can only get into doctors' offices and clinics and not to individuals. Yes, ma'am.
What is the shelf life for the light crystal?
The light crystal has an infinite shelf life. The oral one, once you open it up, it's recommended putting to the refrigerator just to play it safe, but it's not really necessary. But we recommend that people do that because you leave the cap off and the air is dirty and the air has yeast get in there and you may start fermentation. We took the water content off to prevent fermentation, and it has no preservative, but the ATP and GTP itself is on the acidic side. It's a good preservative by itself. The product has all been tested in Colorado by the FDA for bugs, and it was clean. There was no bugs in there because we don't have preservative.
Dr. Merkl, you said that we that are in the U.S. need to write to someone. Could you tell us who we need to write to so we can get the light crystals and the Chondriana into?
No, not in the U.S. If you call the telephone number of our office, they give you the list of doctors or names in other countries. We do not sell we do not manufacture or sell.
Who do we write that letter to? We don't know.
To get the Chondriana?
Yes.
Well, that information is given out from our office to send them to Mexico or Europe or Canada.
What's that number?
Okay. Could we have the number then that we need?
You have to call 915 area code 877 4520. But that we cannot give you any other information. Just give you a telephone number where you call, because we are not allowed to promote, manufacture, distribute Chondriana in the United States.
Okay.
Or just a minute, maybe I can give you directly numbers. Do you have Dr. Villapando's number? I have 011 5216 access code 152001. Okay, that's in Mexico. And you can write there or phone there directly, and that's one of the suppliers from Mexico.
Could you repeat that number again for some of us?
152001. And the access code is 0115216.
Thank you.
Now, there's another number in Toronto, Canada. Man, there is another number in Toronto, Canada. 416-487-0882. And that's Dr. Dabgan.
Thank you.
Welcome. D-E-B-G-A-N, Robbie. 416-487-0882. Yes, sir.
Dr. Merkl, I have some injectable material. I don't have a doctor yet. And I have lupus. I'm also taking prednisone. If I take the injectable material, I can't stop my prednisone. Can I take it at the same time?
I'm really not allowed to give you advice on it. You have to see your doctor.
Okay.
You know, I really can't say because I don't know the drug itself.
Mm-hmm. All right, well, thank you.
You're welcome.
And also, the other question I have is, how many weeks do you stay on it, or is it just dependent on the testing that your own doctor does?
First of all, you know, it's depending what type of lupus you have. You have type A, B, C, or D. They're all different. You know, like the type A is attacking joints, and type B and C attacking organs, and type B is attacking brains. It's depending on what type you have.
God, I hope it's A.
Well, and each one takes different amount of treatment. But our experience, we have a clinic who is working, specializes in lupus in Dubai, in the Middle East.
Oh.
And they report to us that some only takes 3-4 injections, other ones takes 5-6. The general recommended by the clinics to take the whole tube. Again, it depending what type of lupus. Now, rheumatoid arthritis is a lupus disease too, and Chondriana is also very effective against that.
Thank you very
You're
much.
welcome.
Dr. Merkl, you spoke about chemotherapy reducing the effectiveness of the Chondriana treatment. Can you tell me whether there's a time limit? If the body has had chemotherapy, say a year previously, does it have more chance of accepting the Chondriana treatment?
It's not so much that it's affecting the Chondriana treatment. The chemotherapy does a lot of damage to the immune system, the bone marrow. This is why they do bone marrow transplant after chemotherapy. And the stem cell production, which is the germinal centers, which is really destroyed. But chemotherapy not only attacking your bone marrow, but also attacking all your other organs and your tissues. It's very well established, very well known. Now, the reason that the remission rate is lower, not because the Chondriana is affected by chemotherapy, but because the damage has been done to the organ and the body to handle toxins, and the liver and the kidney to function properly, and restoring the immune system. If there is no stem cell production in bone marrow to go to the other lymph organs to form or energy already activate the B lymphocytes and the T cells, then you're left there without an immune system. That's why if cancer comes back after chemotherapy, you are there hanging without an immune system. The Chondriana can rebuild the immune system. It takes about 3.5 months. The problem is that most of these patients don't have 3.5 months. They may have 3 weeks or 4 weeks, and you never get them to the point that they can take the Chondriana treatment. Also, they're very anemic. I just mentioned the Japanese Hiroshima case, that they all lost their blood platelets. And you wonder, you know, when all this radiation and chemotherapy people getting, and their blood platelet counts goes to hell. And you cannot use Chondriana on those people because you have a very strong immune reaction. and they're prone to get a stroke without a strong reaction.